Hi, I'm Jeff Lubson. I wanted to welcome you to the Healthcare Guild. The Guild is a grassroots organization of medical and mental health care providers dedicated to improving healthcare for sexual and gender minorities. I encourage you to share these resources with family and friends across the nation.
The Guild is a grassroots organization dedicated to training and referral for therapists to increase their knowledge when working with LGBT populations.
The Guild is a network of LGBTQ affirmative psychotherapists, practicing professionals, students in training.
The main purpose of the Guild was to provide information to the public about how to find a gay-friendly therapist.
The Guild is here to help others.
It's community building, it's caring people.
We're affirmative and inclusive.
Visionary, essential.
And it's a place for me to go and find support.
The Guild's just a great place to be able to find therapists that are affirming and that don't discriminate based on anything, including sexual orientation.
I look forward to it each month because I feel validated, I feel invigorated.
The Guild is a very good support for therapists, but also a very important part of our communities.
We can even do things like potentially like lobbying on issues.
It's part of all of our growing. It doesn't matter if you're gay or straight or anywhere in between.
It's important so the therapist can know that they're not alone.
Part of oppression and being a sexual minority is isolation and disconnection. So just us coming together systemically makes a statement.
The disparity in the quality and accessibility of healthcare available to minorities, and sexual minorities in particular, is a growing concern. Sexual and gender minorities are defined as those with an identity other than heterosexual, such as lesbian, gay, bisexual, and transgender. In March of 2011, the Institutes of Medicine released a report outlining healthcare disparities experienced by sexual and gender minorities. The report pointed out gaps in research regarding these needs, but highlighted some of the more prominent disparities, which included higher rates of depression and anxiety, as well as higher use of alcohol, tobacco, and substance when compared to dominant culture. Little is known about the cause or etiology of these concerns, yet some of these problems may be due to family and social rejection, as well as internalized shame due to social prejudice. Additional healthcare concerns include elevated risks for certain cancers, heart disease, and sexually transmitted infections. The Lancet Medical Journal followed with an April 2011 article stating that a large number of healthcare practitioners are not well informed about how to care for LGBT health concerns, particularly the needs of transgender individuals. In the spring of 2011, the Journal of Counseling Psychology revealed that sexual and gender-based microaggressions have a chilling effect on those seeking healthcare services. Microaggressions are subtle negative attitudes or behaviors that connote a disapproving or prejudicial opinion towards a person's cultural identity. We have learned that microaggressions have a larger impact when coming from a person in a position of power, such as a healthcare provider. Because of this, many sexual and gender minorities have avoided the healthcare system altogether, resulting in missed screenings, late interventions, and poorer health outcome. In the summer of 2011, the Centers for Disease Control released a report indicating that LGBT youth are at higher risk for attempting suicide, using higher rates of alcohol, tobacco, and substance, engaging in sexual risk-taking behaviors, and being the target of violence at school, in the community, and at home. Recent studies published by the American Academy of Pediatrics reported that a supportive family and social environment significantly reduces these risks. Perhaps the most significant risks, however, have been reported by the National Coalition of Anti-Violence Programs, which revealed that LGBT individuals, and particularly transgender populations as well as people of color, are at an exponential risk for being violently assaulted or the target of harassment. This has certainly been evidenced by more recent studies indicating higher rates of bullying and abuse towards LGBT youth in our public school systems. In 2013, the director of the National Institutes of Health called on educators and providers to address the gaps in LGBT health research. The NIH suggested prioritized areas needed for additional research, which included a better understanding of sexual and gender minority development and how these identities intersect with an individual's cultural social ecology, such as race, ethnicity, gender, and socioeconomic status. It is becoming more clearly defined that the role of being a healthcare provider includes the role of being an advocate. Healthcare providers, including therapists and doctors, are in a unique position to understand the impact that public policy has on clients who are underserved. In response to this growing need, a number of healthcare providers have joined together to form the Healthcare Guild, a grassroots organization of medical and mental health care professionals dedicated to improving healthcare services for gender and sexual minorities.
It's a counterbalance to the other types of therapy out there that one could change and should change. It's a balance of that brings a lot of positive information and important information, accurate information.
It matters that we are out and about and intermingling in different cultures so that we can all adjust. We've all been giving the same messages.
Therapists who are affirmative, it's a way to get good quality, competent therapeutic information, to learn some of the current information about how to work with sexual identity issues, and for therapists not to feel isolated in the work that they're doing.
It's the network for clients who definitely need a strong support. And so the stronger that therapists are within themselves, the stronger they're going to be able to help other people have a sense of either peace or worth or stability that they can offer for their clients.
In summary, the Guild serves as a referral and resource center for LGBTQIA consumers. The Guild educates consumers about how to find culturally competent and affirming healthcare providers. The Guild unites LGBT affirming providers for networking and professional development. The Guild provides education and consultation for developing practitioner cultural competency. And the Guild advocates for sexual and gender minorities by promoting inclusive and competent healthcare policies. The Guild's website is healthcareguild.com. It serves as a consumer resource and referral center, providing networking for consultation, advocacy, and education. I would like to personally welcome you to join the Healthcare Guild online at healthcareguild.com. That's healthcareguild.com.